Hi, I'm Kristy.
And I'm Ashley.
And we are your sim crew. We're going to do a room and simulator review for first semester nursing, Carla Rogers. We're going to review the simulator and the room content so that you have a basic understanding of the equipment and the expectations for your sim day for Carla Rogers. First up is the simulator.
All right, so we're going to come over here to this side of the bed, and we're going to talk about the simulator in general. So the simulator's name is Susie, but your patient's name is Carla Rogers. And she's at a long-term care facility, and over here you'll see some of her personal belongings. So she's got her purse and stuff like that. Some things to note about this simulator are her eyes do not open and close on their own. They're just closed in the closed position all the time. And she also doesn't have any lights or special effects to show any skin conditions or cyanosis, fever, anything like that. She does not have any chest rise when she is breathing. However, she does have lung sounds and a respiratory rate that you can listen and count using your stethoscope. Remember that when you are listening to your lung sounds, you're going to listen to the anterior lobes and confirm with the sim staff that what you heard. If you want to hear the posterior lung sounds, you will just say, sim question, what are the posterior lung sounds? And then we will tell you. To obtain the patient's apical heart rate, you're going to go through the cardiac landmarks and verbalize each location. Once you're ready to count, you're going to find her apical heart tones on the red sticker. So I'm going to show you what that is. So when you are ready, you can say, hey Carla, is it okay if I remove your shirt for a second? She'll say yes, and then you're going to grab gloves. So let me grab those. We'll show you where those are in just a second. So always wear gloves when you're touching the simulator. And then, like I talked about, you're going to go through those landmarks. And if you notice here, because of the simulator, she has this here. It's a white fabric. And down below, you will find a red sticker. When you're ready to get that apical heart tone, this red sticker is where you're going to want to place the stethoscope to hear the best. All right. Let's see here. I gotta catch myself up on where I was. When you are listening, it is not cheating to also palpate for that pulse. That way you can match up with what you're hearing and what you're feeling. You're always going to assume that this white fabric is her skin. And it is okay to listen, like I said, listen and feel at the same time. You're going to want to confirm the heart rate or the respiratory rate that you got with sim staff. So, for example, if I got 100 beats per minute, you would just say, sim question, I got 100 beats per minute, and we will confirm that. Once you get the correct number, you're going to document it on the whiteboard over here, and Kristy's going to swivel you around. And then you will document your vitals on this whiteboard right here. All right, any of the other vitals that you are going to need, you're going to get the supplies in the vitals cart here. It's on wheels, so you will bring this whole cart over to the patient's left side. And then you're going to go through all of those motions. So to obtain the blood pressure, you are going to grab the blood pressure cuff. Hi Carla, I'm just going to get your blood pressure. Put this on my patient's arm. And it's on there, so I'm going to say, sim question, what is Carla's blood pressure?
Your blood pressure is 120/80.
Perfect. So then I'm going to document that up on the whiteboard, 120/80. I'll take this off of you. And then we need an SpO2. So we're going to take our pulse oximeter right here, put it on her finger, and sim question, what is my SpO2?
SpO2 is 94.
94%. So we'll write that on the board. And then we need to get a temperature. All right, Carla, I'm just going to take your temperature. Can you put this under your tongue for me?
Temperature is 98.6.
Perfect. We will document that. And then we need blood glucose. So we're just going to take out our kit. We're going to hold it next to the patient and we'll say, sim question, what is my blood glucose?
Your blood glucose is 130.
130. Okay. Perfect. So that's how you're going to obtain the vital signs. There is also a pen light in this cart if you wanted to assess pupils. Like I said, Carla or the simulator does not have functioning eyes. So you will just flash the light and then say sim question, what do I see for my pupils? And we will tell you.
Pupils are equal and reactive bilaterally.
Perfect. Good. And then you're going to document all that on the whiteboard. When you are doing a head-to-toe assessment, it is important to ask the sim staff for specifics. So, for example, if you want to know if the patient has palpable pulses, this simulator has radial, brachial, femoral, and pedal pulses that you can palpate. So you can go through all those motions and feel them. If you are assessing the skin, you're going to want to provide us with an appropriate assessment question, and we will give you an answer. So an example of that, if you're looking at her legs, and you say, I'm assessing this patient's legs for edema. Do I feel any pitting edema?
You do not.
Okay, we do not. So go through those motions and tell us what you're looking for. This simulator for Carla is wearing a task trainer. So we're just going to move her personal stuff here. And you can see, I think, yep, you can see her task trainer here. So this is an abdominal subcutaneous tissue task trainer so that you can practice sub-Q injections, and you will actually inject simulated insulin into this task trainer. You can use alcohol on this as well. So you can actually inject into here, you just cannot inject into like the simulator herself. Please talk to your simulator when you're speaking, like you're speaking to a patient. So tell her what you're doing and try to keep this as real life as possible. It is important to pay attention to what she says because as a sim staff, we're talking as the patient, trying to give you cues and prompts. It's part of a script. So just kind of make sure you're doing that. Also, please make note that this simulator is plugged into the wall back here and the cords come along to the side. So if you want to raise the bed up and down, lift the head of the bed up and down, that's fine. Just be mindful of the plugs so that you don't pull anything out of the wall. Also, make sure you're wearing gloves whenever you're touching the simulator just to maintain the simulator's skin. And then if you have a question for sim staff or your instructor, you're just going to say sim question. The famous sim question, we have a little sign here, I'll show you. It's backwards, but the famous sim question is, do you actually want me to do this? And the famous sim answer is yes. Most of the time, if there's anything that we don't want you to do, we will tell you that when you come to the sim lab. All right, I'm turning it over.
All right, guys. All right. So now we're going to do a room review. And for the room review, I just want you to kind of just scan over the room here. So Carla is in a long-term care facility. We've said that a couple times just to make sure that you know that. But this room has a multi-functioning kind of patient room for the sake of space and time in the sim lab. So you're going to see that her bed is here, right? And then like over here is going to be where you're going to do your med checks and your medications and stuff like that. You have documentation back here on the whiteboard. You have your sink and gloves and sharps container and all that kind of stuff. And then over here you have patient supplies. We'll kind of get into that as well in a second. Let's start over here, right here, Ash. Okay. All right, so we're going to talk about this area here. This is your sim time. So it's backwards for you right now. It says 9:03. But if you wanting to know what time your simulation stage is at, like if you're on first shift or second shift or whatever time you're at, this is what you're going to go off of. We have a clock in the room that's also for regular time, but this is what you're going to pay attention to for sim time. This is your sharps container. So Obviously, anytime you use an insulin needle or any kind of needle, anything that's sharp, you're gonna stick it in here and it will close just like it normally is supposed to. Please don't put any sharps in the basket or in the garbage or in your pocket or anything like that. And then gloves are going to be here. We have all the sizes. You do not have to remove and change your gloves over and over. So when you put your gloves on, we will normally have hand sanitizer over here. You're going to put your gloves on at the start of your stage. There it is. Okay. And then I'm going to pretend that I'm doing my hand hygiene. I'm even going to say it out loud, hand hygiene. And then if I was to go over to the patient, touch the patient, something falls on the floor, or I check her wound, and now I got to change my gloves and all that kind of stuff, I'm just going to say, I'm going to do hand hygiene. I touched her wound, and now I'm going to go get her food tray, so I need to change my gloves or take off my gloves and wash my hands. So just simulate that or verbalize it. You don't actually have to remove your gloves and change your gloves, otherwise we will go through boxes and boxes of gloves. All right, so once you are done with your gloves, you're just gonna put those in the black trash can. We have two different trash cans over here. We got the black trash can for garbage. We have a blue recycling bin that we fish all of our supplies out of, and then we have this little white basket that we're gonna talk about as well. So the next thing is, let me get my place here too, resource drawer. So our resource drawer has our med books. So there's always 2 med books, and then there's a med book for fluids as well. You can use those. And then we have an office drawer that has pencils, dry erase markers, a calculator, and post-it notes. No pens are ever allowed in the sim lab at any given time. Next, you will come over here to the patient supply cabinet. So your patient supply cabinet for Carla Rogers has some supplies in it. However, the majority of everything that you're going to need is already out for you because this is first semester nursing, and we're not going to make you hunt for stuff on your first day. We actually have it all set up right here on the cart. This cart has all your wound care assessment and intervention supplies. So you have items that you need to wrap your wound, to culture your wound, to cleanse your wound, to assess your wound. Everything is here. It may or may not actually come into play for your simulation, but it's available to you if you should need it. And how do you know if you need it? It's in your patient orders, okay? Or on your MD orders in your patient chart. And then everything on this cart, you can just push it. It's on wheels. It comes, you can put it right by the patient's bedside so that you don't have to try to carry everything to the patient's bed. Next thing we're going to talk about is med checks. So when we come over here, this is generally the location of where the workstation is going to be and the med box. And so when you are ready to do your med checks, you're going to say, pause sim, I would like to do my med checks. And that means everybody else in the room is going to be quiet so that we can hear you and that you have a clear time to review all your meds so you don't make any mistakes. You will do 3 med checks always in every single simulation. You will perform 2 med checks right here under this. There's a microphone, you can see it in the video. Typically this is where the instructors will sit to watch your flow and process with insulin and whatnot, whatever med you're doing. You'll do 2 med checks here, and then you will take your whole workstation over to the side of the bed where Ashley was standing, and you will do your 3rd med check over there. Same location where the phone is kind of at. You will, all your meds can be found in this cart here, in this tackle box, and they are all labeled for the simulation, and then everything that you're going to need is in here. Alcohol, pads, insulin needles, med cups, medications, etc. When you're giving a med, if it's going to be a PO, capsule or tablet or something like that, You're simply going to do your med check. You're going to put it in the med cup. When you're ready to administer, you'll take your whole workstation and your cup, and you'll take it over to the patient's bedside, and you'll simulate or pretend, gulp, that you gave it to her. And then you're going to take this medication like this, and you're going to stick it right here in that basket. And that's how we can verify the dosage that you gave the patient in this situation. If you are expected to inject insulin, again, there are supplies here. You'll take your needle out. A lot of the stuff we have may be expired, but it's okay to continue to go through your med checks like you're expected to do in skills and confirm that the supplies that you have are indeed safe to use. And then to simulate a phone call, if you need to make a phone call, you're simply going to find a microphone. In this room for Carla Rogers, there's 3. You're just going to stand under one of them and say, "Sim question, I'd like to make a phone call. I'd like to call Dr. XYZ." And then we will just simulate that over the speaker with you, or we'll talk back and forth with you as the doctor. Okay? The head walls in the sim lab, they function and work like they're supposed to. So this is called a head wall. Okay, the head walls have basically what you're going to need for oxygen and air and suction. So if your patient needed oxygen, you would get a cannula, you would hook it up to the oxygen, and then you would turn it on to wherever it needs to be. In other videos on our Sim Lab how-to series, we go over how to use the flow meter on the head wall. So if you need to review that, go ahead and do that. But just so you know, everything is functioning for Carla Rogers. And then your simulation may have a live actor. So if your instructor or one of the sim staff walk in, they're probably going to say, "Oh, I'm Dr. So-and-so," or "I'm the patient's granddaughter," or something like that. That simply means that they're acting as somebody because it's part of the script of the simulation. You'll continue your sim, you'll continue doing what you're doing under the impression that you are communicating with that role player now. For Carla Rogers, there are 5 stages for this simulation. The first stage is 2 students, 1 med and 1 assessment. The assessment nurse is in charge of doing the general assessment, communicating with the patient, and performing interventions that are for treatments. Your med nurse is responsible for checking critical assessments, checking the indications and safe administration of medications, administering the med, and then documenting on the MAR. The second, third, and fourth stages of Carla Rogers are only 1 student roles, which means only 1 student will be in here, performing as the med nurse and as the assessment nurse. The 5th and final stage has 2 students in it, again, that are assessment and med, that will function just like the first stage. If you're wondering what you're going to be doing in between, like if there's only 1 person in here, what do the other 5 or 6 students do? You'll be in the conference room doing homework, working on stuff for class, and in between those stages, you'll be giving report. So like if the students are in this room, when they get done with their stage, they're going to go give report to the next student who's coming in. So that's what you'll be doing. What you won't be doing is speaking or talking on your cell phone, text messaging, or social media. We got to make sure that we keep that the understanding is clear, just as if it was in a clinical day at the hospital. Let's see. You will be allowed breaks in between all the stages. So typically the stages are anywhere between 25 and 35 minutes long. So every 25 to 35 minutes, you'll be able to go to the bathroom, take a break quickly, and then we will start again. And then there's also a 30-minute lunch time that is also included in your sim day as well. You'll get to go to the cafeteria or heat up your lunch, and then be back in the conference room here in the sim lab at the determined time that either Ashley or I give you for debrief. There is a separate video about the MAR and the TAR and the patient orders that you can watch to help you understand how to navigate, how to read that document, and how to fill it out. Lastly, to assist you in documentation and report, we have 4 different forms that are in the conference room that you can look at. You don't have to use them, but if you need something to guide your report or guide your flow when you're getting your patient vital signs, you can use it. Again, it's just something for you to determine if you want it. You don't have to use it. When you come back from lunch, we're going to run through a debrief, which is a required session where you get to reflect about the simulation. You're going to reflect with your peers, your instructor, and us. And then you're going to complete the required post-simulation survey, which is anonymous, and it's your voice for any changes or feedback that you have for sim. It's important to note that you have to be on time for simulation. If you're more than 5 minutes late for your simulation and you don't confirm with your instructor or contact the instructor, you won't be allowed to come into the sim, and we will have to ask you to leave. If you're rude or disrespectful to your peers, instructors, or sim staff, you will also be asked to leave. There's a behavior form that's in your student sim lab handbook. It's also posted in all of the conference rooms in the sim lab. It has the indications for students for remediation and removal. So if you need to review that, go ahead and review that. It's posted. All in all, we hope that this video was helpful in preparing you for your Carla Rogers simulation. We are not going to review the room or the equipment on sim day unless there's a major change or something like that to the scenario that we have to update you. But this is pretty much everything that you need to know as far as the setup and how-tos. We hope that this is helpful and it supports your learning and your nerves for when you come to sim day. Yeah. So please email us if you have any questions or if you need anything. Otherwise, we hope you guys have a great day. Bye. Bye.